Hi everyone, welcome to today's session. Today we are going to see question and answers from pharmacology. Moving on to question number 1. Tetracycline is contraindicated in, they've given 4 options: children, pregnancy, renal failure, all of the above. The answer to this question is option D, all of the above. It is contraindicated in children, in pregnancy, and also in renal failure. Moving on to question number 2. Fluconazole is used for the treatment of pemphigus, herpes simplex, candidiasis, syphilis. The answer to this question is option C, candidiasis. So fluconazole comes under triazoles in the classification of antifungal drugs. So moving on to question number 3. The drug of choice for treatment of typhoid is tetracycline, metronidazole, ciprofloxacin, cefotaxime. The answer to this question is option C, ciprofloxacin. Moving on to question number 4. Desfluroxamide is a drug used for Kala-Azar, pernicious anemia, pain control, thalassemia. The answer to this question is option D, thalassemia. So desferrioxamine is chelating agent for iron. It's mainly used for acute iron poisoning cases, transfusion siderosis, which occurs in thalassemia patients receiving repeated blood transfusions. Moving on to question number 5. The mechanism of action of chloramphenicol is inhibition of synthesis of cell wall, cell membrane, protein, DNA. The answer to this question is option C, protein. Moving on to question number 6. Which one of the following is penicillinase resistant penicillin? They've given 4 options: amoxicillin, cloxicillin, ampicillin, penicillin G. The answer to this question is option B, cloxicillin. So another example for penicillinase resistant penicillin is the methicillin also. In case if they've given methicillin, even that is an example of penicillinase resistant penicillin. Moving on to question number 7. Prolonged administration of streptomycin may result in damage to the optic nerve, facial nerve, auditory nerve, trigeminal nerve. The answer to this question is option C, auditory nerve. Moving on to question number 8. Optic neuritis is a side effect of rifampicin, INH, pyrazinamide, ethambutol. So what is this INH? INH is a short form for isonicotinic acid hydrazide. So that's called as INH. It is an antibiotic used for the treatment of tuberculosis. So the answer to this question is option D, ethambutol. Optic neuritis is a side effect of ethambutol. Moving on to question number 9. Tetracycline in children causes calcification, missing teeth, discolored teeth, peg teeth. The answer to this question is option C, discolored teeth. Moving on to question number 10. First line of anti-tubercular drug is streptomycin, again INH, ethambutol, all of the above. The answer to this question is option D, all of the above. So if you see the first line of drugs, isoniazid, rifampin, pyrazinamide, ethambutol, streptomycin. All these are the first line of drugs for tuberculosis.